Hi, my name is Angela, and today I'm going to be talking more about clinical rotations and kind of how a student could really be successful on APPE rotations or IPPE rotations if you are a pharmacy student going through that process. Just to recap, my name is Angela, and I am doing these videos to hopefully help anyone who's interested in pharmacy school or who's in pharmacy school and interested in residency. I just finished my last rotation just last week, and so I'm going to be hopefully a PGY1 resident. Well, I will be a PGY1 resident in ambulatory care track coming up here in June, and hopefully graduating and becoming a pharmacist here very soon. So the last video that I did was just updates on my rotations and other things going on with my pharmacy career. And I kind of went over what I liked and didn't like about my rotations the past year and gave some quick advice. But I'm going to give some more in-depth advice in this video and make sure to keep it under 10 minutes. And I may go into another video on this because there's so much that could be said about rotations and ways to be successful on them, and all the rotations are diverse. So I don't want to just cover a bunch of stuff because it really wouldn't be helpful, but I do want to cover things that I feel like would be beneficial. So we'll see where we go, because there's also the ways that you should be prepping for residency when you're on APPE rotations, and that's another discussion. So I think for this video I'll just do general advice, and then I'll go in the next video and do like a timeline of kind of what I did or what I would suggest others to do in terms of prepping for residencies while you're completing your APPE rotations. So just in general, for patient care in general, you're going to be partaking in patient care in a very unique way that you haven't done in pharmacy school or on IPPE rotations. Now, every IPPE or intermediate pharmacy practice experience, I think is what it's called, the ones that you do before you're finally about to graduate in your fourth year, those IPPEs typically are with a lot more supervision. You do not have as much clinical knowledge, so your experiences are different. Although some people have had very highly clinical IPPEs, your APPEs will be very different, advanced practice pharmacy experiences. They will be way more hands-on, and you will be expected to be much more autonomous than you have been. So what is a good tip is before you go into a rotation, whatever type it is, you should try to review common disease states that you'll see when you care for patients in that area. So if you're going into a cardiology rotation, review ACS, hypertension, hyperlipidemia, acute MI, all those other different atherosclerotic issues. Review those and study them before you go on rotation, so that when you get into the rotation, you're kind of prepped and ready. If you're coming off of another rotation, you could take the weekend before or the week before to kind of read over that stuff, because it can be hard to double two rotations and prepping for both. It can be hard. There are things that you should probably be able to quickly calculate on your own, such as creatinine clearance, patient's ASCVD risk. Now you'll use the ASCVD risk calculator, but and like their BMI. Those are three things that you probably should really be easily able to do on rotations. And your goal as a pharmacist is broad, depending on where you're going to be, but your goal is to monitor the safety and efficacy of every medication. So you should be looking at each medication on a patient's profile to some extent. Sometimes you can't do too thorough depending on what you're doing, but you should be looking, is this medication effective? Is it safe? Is it appropriate? How do I monitor its safety and efficacy? So that's going to be your job and what you should really hone in on as a pharmacist on these rotations. So that's just something to keep in mind. That's my main job, is that's what I like to keep in the back of my mind. You should start utilizing your clinical resources very easily and quickly. You should be able to pull up Lexi, pull up Sanford, understand what they are and how to use them, PubMed. Start getting comfortable with those. You've probably used them on assignments or in other labs or classes before, but you should be using them much more regularly and being able to be quicker and replying to answers and not thinking, how do I tweak my answer so I can get the best grade? How do I get the answer that's correct in the moment? That's what you should be thinking of. And it's important that you establish a really good orientation or a really good start to the rotation. Hopefully your site will help you do that, but you should start the rotation and understand what your month is going to look like, and understand what your preceptor wants out of you, or what they would expect you to achieve by the end. And if they don't give you that, or if they maybe give you goals but you realize that you don't have the same goals, verbalize what you want to get out of the rotation, what your goals are, and communicate that to your preceptor right at the beginning. So let's say I'm going into a cardiology rotation. I am actually very confused about a lot of the antiarrhythmics and AFib. But let's say my preceptor wanted me to get really comfortable with heart attack and ACS and stroke and all that kind of stuff. So I would, of course, wanted to accept that goal, but then bring up to him or her that I really wanted to learn more about AFib. And then they could say, okay, yeah, we'll spend a week really diving into that topic deeper since you brought that up, since it's what you can benefit from. A lot of preceptors want you to be the practitioner that you want to be, and they want to help you achieve your goals. So bring it up to them. Otherwise, they won't know because they don't know you when you first get to the rotation, most likely. You're going to absolutely have to present patients to your preceptor on a majority of your rotations, if not all. You're going to have to present a case of a patient, maybe in a formal way in a case presentation, but on a daily basis, you're going to have to work up patients, and by that meaning, understand what's going on with them, understand the kind of therapies, understand their progress in care, and be able to add your own clinical input and assessment of what's going on for the patient, if it's appropriate, if there's changes, and any plans that you might have. So just know how to do that in an organized way. I had templates depending on what rotation I was on, because sometimes I was ambulatory care rotations, and the kind of monitoring and assessments I was doing for like screening and follow-up and chronic disease management was not the same when I was in internal medicine. There's a lot different priorities. So it'll change, but still I knew kind of how to organize things. They call it the SOAP note format, so subjective, objective, assessment, and plan. You collect information that's subjective from what the patient provided or their family, objectively their labs, their diagnoses, their medications on board, the plan, what you think is going on, and what the team is planning for the patient, kind of what the approach is, and then your assessment, your own clinical assessment of that. Yeah, I agree with what's going on, or yeah, I agree, but I would actually want to recommend this medication change or this change or this idea. Or so that's your own clinical assessment there too of the plan. So that's kind of how you would maybe present a patient, just basic, but you could present it by problem, by clinical problem, so like by disease state, or you could present it just in full. So if I had a patient and I did a subjective and objective, I could do objective, okay, here's what's all going on with their diabetes, here's what's all going on with their blood pressure, here's what's all going on with their infection. Or I could just say, yep, we got all these problems going on, and then kind of wrap everything together. So there's a lot of different ways to do it, but just be prepared to do it and don't be uncomfortable with it, because that's something you should be comfortable with that. So also there's something called ISBAR, which many of you probably know as pharmacy students. That's a situation, background, assessment, recommendation, a little bit different order. And the I stands for introduction. So, hi, I'm Angela. I'm here to present about patient X. And then here's some, similar to SOAP note, only a little bit different. And after you present that, you should be constantly ready for that feedback on how you did and what you did. So you should be ready to tweak what you've been doing in terms of working up patients and presenting them, depending on what your preceptor would recommend. All right, so I'm only going to get to another point here, and then I'll end the video, and I'll have to go into another video because this is, again, so broad. But do not be afraid to ask questions. Ask as many questions as you need to. I am a very curious person. I asked a lot of questions, and I got that feedback on my rotations. And most of my preceptors, if not all of them, said that they appreciated that, because they appreciated that I was there to learn, and that I was there to learn from them and gain their knowledge. And I wasn't afraid to explore my areas that I didn't know, and I was not afraid to ask those questions. So that is your time to do it. There are appropriate places though to ask questions, maybe not in the middle of rounds when the physician is talking. Maybe it's later after you guys have went through rounds and you've kind of done a couple tasks and you have more time to have a discussion. So try to seek that out, try to know and feel out the situation. But also just, if you don't know, say, hey, I have some questions, when can we discuss this? And let the preceptor tell you that. That would be a good idea. If you don't know an answer, don't guess. Most likely that is not going to get you very far with your preceptor. They do not want you to pretend like you know when you don't know. They'd rather just say that you don't know. Or say, I don't know, but I'll look that up and get back with you. Just don't guess, because you may guess wrong. If you make a mistake, just acknowledge it. Say, yep, that was my fault. Show gratitude for your preceptors for accepting your mistakes and for helping you through it. Always appreciate the process and tell them that you're very grateful for what they're doing for you, and that'll go a long way. So that's all that there is for now. I'll finish it up hopefully in a couple videos, but hopefully this was helpful. If you like the video, like it, share it with anyone you think it would be helpful for, and comment below if you have any ideas that you want me to talk about. So thank you.